Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. Hello, I think you'll find this case interesting. It's a case you could walk into your office. These three teeth right here were a train wreck, and I had to extract those teeth, graft the sockets, wait 6 months for the bone graft to heal, and then place these three implants. So let's go through how we did this. This is after the extraction. These are the teeth just decayed underneath the crowns, had to be removed, some abscess teeth. I'm going to wipe the site with chlorhexidine and then dry it, and then I'm going to mark the places where I want to place the implants based on spacing and based on the bone. So I'm going to measure. I can see the most distal implant from the height of bone to the sinus is 12.73 millimeters. So I wouldn't mind placing a 14 millimeter implant in that site. This is the OCO implant system. I like that a lot. I like drills with shoulders on them. I don't want to have to think about the depth of the drill with every drill. Here in the second one, the alveolar crest to the floor of the sinus is 8.01, so I wouldn't mind placing a 10 millimeter implant in that site because I'm going to engage that compact bone, which would stabilize the implant. You do not have to engage the floor of the sinus, but it's not a problem if you do. And then the third implant, which would represent the first bicuspid site, is 7.39. So I wouldn't mind placing, say, a 9 millimeter implant in that site to engage the compact bone in the floor of the sinus. This is the system. Take a periapical radiograph of the drill in the site. You've got your depth. You don't have to keep thinking about it. If you've got a drill that's just got lines on it or colors on it, you've got to try to watch that color or that line with water, saliva, blood, and it's hard to keep up with it. And it's just a mental strain to have to try to keep up with it with every drill. So I like every drill to have a shoulder on it. That's something I really look for. And see, I'm trying to drill in line with that line, the appropriate distance from the bicuspid if you're not using a surgical guide. Now, I like surgical guides. You often don't have to have them. So see, this is parallel to this, approximately parallel to that tooth. So here's the floor of the sinus. So the thing to think about, there's 2 millimeters of tissue coronal to the alveolar crest, 2 millimeters of soft tissue. So if you think you're going to use a 14 millimeter implant, you're going to use a 16 millimeter drill, because if you're going straight through the tissue, which I like to do, because you don't have to reflect the tissue to place the implant, and then whenever you come back, you don't have to take a core through the soft tissue and anesthetize the patient. It's just easier, in my opinion, if you go through the soft tissue. Plus, while you have the healing abutment in place, it's forming the tissue around the implant. So it's creating the proper tissue formation around the implant while you're in the the patients were in the healing abutment. I only want to perforate the sinus 1 to 2 millimeters. We've got good hard bone. That's what you're looking for when you graft a socket. You want the bone to be really solid when you're placing the implant, because you're going to torque it to 35 Newton centimeters. They don't have to be exactly parallel, but you want them generally parallel. That's when I put the marks and the lines so they're spaced correctly and they're approximately parallel. Those look good. See, so here's the floor of the sinus. Now, since they're 3 in a row, I didn't want to make them real wide. So remember, you want the implant to be about a 1/2 millimeter or so wider than the final drill width. That's the Dental Minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterClasses.com is here for you. At DentistryMasterClasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterClasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Master Classes, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to DentistryMasterClasses.com and subscribe today.